Everything is started.
Okay, thank you. Good afternoon, everyone, and welcome on this cloudy summer day. Good afternoon. My name is Mercedes Witowski. I'm the Executive Director at the New Jersey Council on Developmental Disabilities. I'd like to welcome you to today's bipartisan Legislative Disability Caucus session that's focused on accessing dental care for individuals with disabilities. Closed captioning and sign language interpreters are available for today's session, and this session is being recorded. It will be available along with all previously recorded Disability Caucus sessions on a web page dedicated to this topic. You'll also be able to locate on this web page the 36 legislators who are Disability Caucus members, and you'll be able to read the descriptions and contact information for the 50 supporting organizations. You can sign up for emails, you can submit comments or questions on any topic, including today's topic. And I think one of our session organizers will put that link in the chat for you. Please remain on mute if you're not speaking, and attendees are in listen-only mode. So the Disability Caucus is here today as a bipartisan forum within the legislature for lawmakers and their staff to consider the impact on the disability community when shaping all public policies. We know that with increased awareness and a greater understanding of the complexities of our service system, that we can accomplish much more understanding in the legislature. People with disabilities, their families, the organizations that serve and support them remain a resource for legislative members, and we encourage our caucus members to reach out to those supporting organizations like the Ombudsman, the Supportive Housing Association, SPAN Parent Advocacy, the ARC of New Jersey, the Bog Center, Disability Rights, and all the other supporting organizations who are ready to assist and offer their support. A special thank you today to Senator Anthony Bucco of the 25th Legislative District for his commitment as co-chair to the caucus and for taking the time to lead this afternoon's meeting. I'd also like to thank and welcome the other co-chairs and their staff, Senate Majority Leader Teresa Ruiz, Assembly Majority Leader Greenwald, and Assemblywoman Ora Dunn. I'd like to also thank all Senate and Assembly members of the caucus for your ongoing support, as well as your staff. I see here today we have Assemblyman Sawicki, Borelli, Assemblywoman McCoy, Assemblywoman Fantasia, Assemblywoman Murphy, great to see you, Senator Moriarty. We have a representative from the Senate Majority Office here. We have Senator Corrado, thank you, good to see you. And staff from the Senate Republican Office, as well as I mentioned before, our Majority Leader, Greenwald, who is one of the co-chairs. So now I turn our session to one of our very staunch leaders in the caucus and his commitment to people with disabilities, Senator Bucco.
Thank you, Mercedes. And thank you for all the work that you and your staff do to make these quarterly Zoom meetings possible. They're critically important to the disability community. Thank you to my co-chairs and the 36 other legislators and 50 supporting organizations that are on the call today, and for all the work that you do as well. You know, we have had much success with the caucus over the last few years in raising awareness, in making positive changes, but we still have a long way to go. There are still many issues to tackle and many things that still need change here in New Jersey to make folks with IDD give them a better life. Today's focus, I think, is a critical topic, not one that we think about often, but when you start to dig into it, you realize just how important it is to those with disabilities. And that's access to dental care. Dental care is critical to a person's quality of life and overall health. And anyone that has had dental issue understands that right from the very beginning, how it can disrupt your everyday life. And unfortunately, those individuals with IDD in New Jersey continue to face significant hurdles when it comes to dental care, whether it's a limited number of providers or inadequate training for the professionals that are out there, low Medicaid reimbursement rates, which is the source of payments for most patients with IDD, or various physical and communication barriers that exist for folks to be able to get in to get the care that they so desperately need. Today, we've got a great panel of experts with direct experience that will help navigate us through this process. And I know that my colleagues join me in looking forward to a great discussion. But what are some of the issues that we can do? First, we can probably look to increase the Medicaid reimbursement rates. That I think is important to being able to get folks to want to train in this area. Enhance the training programs in our medical schools and professional associations, so that our professionals are trained in this area to do the work that's necessary for those with disabilities, and improve accessibility. Whether it's establishing guidelines for accessibility through rulemaking, or state appropriations for upgrades to dental facilities. These are all things that other states have started and that we need to look at as legislators to make sure that those most vulnerable can have a great quality of life. So I'm anxious to get started. I don't want to delay this any further. I'd like to be able to start the panel so that everyone can have an opportunity to ask some questions and get some great answers to start moving this process forward. So so our first expert, Dr. Fossey, if Mercedes, if you want to introduce him, or if he's just going to come on, which either is fine by me, but I think we should get started.
Okay. Thank you, Senator. You've already laid the groundwork, and appreciate the time that we're going to take on this session today. Just last week, I watched a segment released by New Jersey Business and Industry, a one-on-one with Steve Adubato. And the segment featured Dr. LeBeau, the Chief Clinical Director at Delta Dental of New Jersey and New York, and Dr. Velasquez, President-elect of the New Jersey Dental Association. They covered significant aspects of oral health and the barriers that face individuals with disabilities, and we really appreciate their spotlight to this issue. It came right in time with our segment today. I hope you'll all get a chance to look at that recording. I'll tell you that in my role on the council related to oral health, we hear way too many conversations and here's too many stories about people with disabilities and their loved ones, what they bring to us. Some of these stories are extremely horrific and unthinkable, in that some of the most vulnerable people in our society and those that care for them cannot access the care that they need to maintain oral health. Some wait years to get the care that they need. And at the end of the day, yes, Senator Buch, I think we can solve some of these struggles that people face with some broader brush solutions, but other matters really have to be addressed one at a time, one person at a time, but with a sense of urgency, because we can't delay care. That results in further harm and in trauma, and really creates the poorest quality of life for people. So to dig in, we're so pleased to have Dr. Chelsea Fossey join us today. She was involved in a project that the council sponsored addressing barriers to dental care right before COVID. Unfortunately, COVID got in the way, but we're back today. And again, Dr. Fossey, it's happy you're here. Dr. Fossey is the director of the Research and Policy Center at the American Academy of Pediatric Dentistry. She is boarded in dental public health, and before shifting her career work in oral health policy research, she worked as a general dentist in New Jersey and New York, treating primarily individuals with disabilities. Dr. Fossey has so much vested in experience and connection to this work that we're doing today, and we're so glad that you've joined us, Dr. Fossey.
Thank you so much. It's an honor to be with you all. And Senator Bucco and Mercedes, you have provided great foundation. I think I can, wrap up, talk about some of the policy solutions, because you've already talked about a lot of the problems. But I'm being facetious. I will go into some detail on the project that was in place from late 2018 to early 2020. The report was submitted kind of just before COVID really hit the US. So again, thank you so much for being here. It is so awesome to see a disability caucus and to learn a bit about the possibilities of other states doing similar things. Libby had shared with me that there are a handful of states that do similar, but I'm not surprised at all to learn that New Jersey is the one kind of leading the way on this. So thank you all for the time today and for caring about this. As mentioned, NJCDD, the council, sponsored this grant project addressing barriers to oral health and healthcare for adults with intellectual and developmental disabilities in New Jersey. From late 2018 to early 2020. The awardees were Columbia University and the National Center for Children in Poverty. So it was a joint effort between those two organizations. The PIs, the principal investigators on the project, neither of them could be here today, but their names are Dr. Kavita Ahluwalia and Dr. Heather Kobal. Dr. Ahluwalia from Columbia and Dr. Kobal from the National Center for Children in Poverty, or NCCP. Then the rest of the core team, what comprised the rest of the core team was myself, Chelsea Foss, and also a colleague, Sue Massetti, who was at NCCP. It was a pleasure working with them. The goals at the outset were to identify the barriers to oral health for people with IDD and to develop an advocacy plan, a 5-year advocacy plan for stakeholders in New Jersey to consider and to hopefully act on. I'll say at the outset too, there was another goal, and that other goal was to develop a provider directory. I'm not sure in the other conversations you have, especially regarding healthcare, provider directories are fraught with challenges and complications. Over time, we ended up shifting gears and recommending that we not go that route at that moment. So that was in consultation with the council, but it was an initial goal that we kind of decided to not prioritize throughout the project. As Mercedes mentioned, the project was inspired by NJCDD member concerns. So, this was brought by patients and families and caregivers in New Jersey who were coming to the council and saying, this is not okay, we're not getting the care we need, and their concerns are backed by evidence. We know that people with IDD suffer disproportionately from dental disease, might have a more difficult time with home care, and are facing other challenges like long wait times that Dr. Spivak will speak to in just a little bit. And as Senator Bucco mentioned as well, we know oral health is crucial for overall health. It's connected to a number of chronic diseases that we know the IDD population is already at increased risk for: cardiovascular disease, diabetes, et cetera. And it's also linked to quality of life, self-image, speaking, eating the foods you want. So the quality of life we cannot jeopardize for this population. And at the time, there were about 25,000 adults with IDD covered by or receiving services through the Division of Developmental Disabilities in New Jersey. And those folks were eligible for Medicaid services. So we decided to focus specifically on adults with IDD, and therefore there was a heavy Medicaid interest in our work as well. So over that time, we did a number of things that I'll briefly mention, but then really want to focus on what were the takeaways? What did we learn from this, and where do we go from here? We did a literature review. We did focus groups and interviews with individuals with IDD, with their families, their caregivers. We did key informant interviews with policymakers, insurance representatives, other researchers, both within New Jersey and beyond. We did a survey of dentists on their experiences working with this population, or barriers to working with this population, rationale for not expanding their patient base to include those with IDD. We had 2 events to supplement and learn more in these activities. We had an oral health summit with key stakeholders throughout the state. And then we ended near the end of the project with a meeting with the Medicaid managed care organizations and other state offices. Some folks here were present for that. It included the state Medicaid director, state dental director, New Jersey Association of Health Plans, etc., the ombudsperson for people with IDD, so a lot of key stakeholders. What we learned from that work was not necessarily, for the most part, surprising. I think for the most part, we anticipated learning what we learned. That there were, individual and family level factors, that where you reside can have a big influence on how easy it is to get care. The severity of disability is a big factor. There are provider level issues at play too, such as lack of training, lack of comfort, interest, awareness of the need, challenges with Medicaid, whether it's reimbursement rates or administrative burden, and then challenges with access, finding care teams, finding dentists, the physical accessibility, sensory environments that are suitable, or when necessary, care in settings that offer general anesthesia, sedation, and what those wait lists are like. So let me get into, with the few minutes I have left, just an overview or a sampling of some of the opportunities that we pinpointed and offered to the council to consider for the future, that maybe now is the time to pick back up on, since there was the COVID hiatus with this work. But one, and some of these are overarching, there's a different level of complexity with each of these. But one is, in any ongoing work, to definitely involve the state dental director and ensure that those with IDD are represented in state oral health plans going forward. So many states do a 5-year oral health plan. New Jersey's one of them, and making sure that there's really special focus on those with IDD in that oral health plan going forward. Another idea is to, within Medicaid agencies are required, as I'm sure many of you know, to have beneficiary advisory groups. And we recommend that New Jersey Family Care, New Jersey Medicaid consider the development of a subset group, a subcommittee, a sub-advisory group that is really focused on those with IDD. So a lot of the stakeholders we already mentioned, organizations we already mentioned, of course, having individuals with IDD and or their families and caregivers represented to really advise Medicaid directly on what challenges are. Medicaid reimbursement, I know Dr. Spivak will talk about this too, but making sure the lines of communication are open with the dental director in New Jersey Family Care, and that we're continuously evaluating reimbursement policies and when necessary, considering what specifically do we need for the IDD population that the general population, it might not be as important for the general population. Are we paying for things like desensitization visits that could really help the comfort level for the patient? Another area that really emerged as promising is the care management programs that the managed care organizations, the MCO entities, are required to offer. It seems like it's really hit or miss, at least at the time, with how successful the care management programs were for the population, for the adult with IDD population seeking dental care. So I think there's a lot of possibility there in getting the care management programs together across the MCOs to figure out what works and what doesn't, to make sure that we can get this population into care. There are some policy directions to go, some that are frankly, federal, although there could be state level bill that could address the same sort of thing. Obviously, loan repayment programs in the health professions are coming up left and right, and perhaps there should be some considered specifically for those who are treating and commit to treating those with IDD. There's been an effort again at the federal level called the Heads Up Act, and that is to ensure that those with IDD are considered per the Health Resources and Services Administration as a medically underserved population. And that opens up the doors for some flexibilities that could really improve the financing and delivery of care there. New Jersey has just the best environment for partnership on both the disabilities and the oral health front. There are so many great organizations working really hard, a lot of experts in disabilities and in special care dentistry. Dr. Spivak's one of them. So there are plenty of opportunities to get the right people at the table and have the right leadership for going forward. I would be pleased to answer any questions and talk further. I could just really scratch the surface on this work. There are some other developments that are going on the federal front that could have and actually have already had some impact or some activity, led to some activity in New Jersey. And we'd be happy to talk more about those at a future time. But I thank you so much for letting me share about this project.
Thank you, Dr. Fossey. Why don't we pause for a second and see if there's any questions of Dr. Fossey? It's just incredible how 5 years ago, when this report was completed, that it still stands very true and current. It's good and bad, right? Dr. Fossey, so any questions for Dr. Fossey?
Yeah, I have one, if it's all right.
Sure.
In the project you did and the results that you found, were there any specific services that needed more attention than others? Like, for example, the difference between cleaning, right, and orthodontics, for example. Are there anything that stood out that really needed to get addressed more than others?
Yeah, one area that always seems needed improvement then, I think probably still needs improvement now, is some prevention or preventive services, and especially the frequency with which those can be provided. Oftentimes, dentists or dental teams who are seeing patients with IDD would like to see them more frequently because, again, home care is a major challenge. And depending on what the dental plan allows, that may or may not be possible for the family, for the dentist, et cetera. So that seems to be, one area that we really go back to. As we all know, what's most common is see your dentist twice a year. And with a lot of these patients, we want to see them 3 times a year, 4 times a year. So making sure that sort of opportunity is in place per Medicaid largely.
Great, thank you.
Thank you again, Dr. Fossey. Thank you, Assemblyman Sawicki, for that question. There is a link to the full report in the chat for everyone to be able to access. I know
I
Dr.
do have a
Fossey,
question.
yes.
I'm sorry. I also had a question. I apologize. When in the research that you did find, did you, and this probably won't be a surprise either, but did you and your team identify any that? And I was wondering if that also, if that followed suit as well, that there were definite provider deserts in rural areas.
I'm so sorry, I missed part of the question, but I think I captured enough of it to to answer. Does the rural disparity with provider location kind of exacerbate
Correct.
this issue too?
Mhm.
We did not look. We did not build upon other work, that's been done with health professional shortage areas. So we did not kind of overlay those two, but I am quite certain that your hypothesis is correct. But in this work, we were not looking too specifically at location of provider. I think it was a little beyond the scope of this, but I think your hypothesis is probably very accurate.
Thank you. I was curious because I know, other states that experience this as well, and, even more rural states. I'm wondering what kind of solutions they actually come up with, be it mobile, units that go and visit different areas, or, just I'm always thinking along those lines. I happen to represent a rural district, and the reason why you didn't hear my whole question is because our internet is awful up here still, in 2024. So I apologize for my connection, but that's always a concern up here, is for services along those lines for this population. But thank you.
Thank you, Assemblywoman. And again, thank you, Dr. Fossey. We're going to move to Dr. Spivak because we're delighted to also have you join us today. Dr. Spivak has devoted his career to direct patient care and the education of future dentists and healthcare professionals in the provision of dental care. He's a professor and a program director at Rutgers Special Care Treatment Center at UMDNJ. Thank you for joining us. We're eager to learn about your work and your contribution today.
Much rent do I owe? Not much.
Thank you very much. I appreciate it. So just to give you a quick brief background of myself a little bit, just to give you a sense of where I'm coming from today. First of all, I want to thank you very much for having me here and letting me share my experiences and my insights into this population. I've been a dentist for about 33, 34 years now at this stage of the game. And I've devoted my entire career to working with the disability population very, very broadly, and very specifically with the intellectual and developmentally disabled population as well, specifically with that population over the last pretty much 25 to 30 years. So I have a broad range of experience within this population, and I started off as a dentist who really planned on going into private practice. But after I did my residency training, after I did my fellowship training, I really found a love and a need for working with this population of patients. And this is really what I've developed, really devoted my life to at the stage of the game. I've devoted my career to. I'm working now at the dental school. I am involved primarily in patient care, direct patient care. We see thousands of patients a year in our clinic. And we see several hundred patients a year that have to go to the operating room for care because they're unable to tolerate the care, either because of medical issues or because of behavioral issues. Generally, we're seeing the most complicated of these patients. We're a tertiary care institution, and we have patients coming to us from other hospitals, from other private practice providers. We have patients coming to us who, as parents and as other caregivers, they've just been looking around for trying to find dental care for their children, for other people that they need to care for. So this is what we've been doing. What we really have found is that the problem that we see with our patients is that they're coming from all over the place. We have patients coming from North Jersey, South Jersey. Many of our patients are traveling in excess of 2 hours to come for care, sometimes for as little even just as an exam and a cleaning. And this really has become a problem. Many of our patients are fairly frail. Again, we're dealing with the most complex of this patient population. So to deal with this population, to have them traveling all this distance really is problematic. And to address, the concern, that we heard from the Assemblywoman before, really this is a problem where we do need to find some way of addressing this concern of getting care to people that are outside of, being able to come to see us. There are other hospital dental programs that are available, but unfortunately their waiting lists tend to be pretty much what ours are. Right now, the wait list to come in and see me or any of the other 4 dentists that we have here in our program is really about 6 months. It's close to 6 months, and that's for just a general dental visit. That's to just come in and see us. To get into the operating room for those patients who do require that care, the waiting list is in excess literally of 3 years. And really, that's an extraordinarily unacceptable sort of thing to say. And it's almost embarrassing for us to have to say that in this day and age, but this is what the reality is. In New Jersey, as you're all very, very well aware, we have an extraordinarily large population of individuals with disabilities, specifically with developmental disabilities. Autism is higher in this country, in this state per capita than it is in any other state of the union. And these numbers keep increasing and they keep building. Many of my patients are coming in with family members who've tried moving elsewhere for other reasons, and they come back to New Jersey. In large part, it's because of the availability of services and healthcare. And even though we can hold our heads high and say, listen, we're doing a good job from that perspective, clearly we're not doing enough to help them. The special needs population has really very much shifted over the course of time. And like I said, I've been doing this for about 33, 34 years now. We're seeing a population now that is aging. When I was a dental student, the average life expectancy of an individual with Down syndrome was about 30, 33 years of age. The average life expectancy of an individual with Down syndrome now is in excess of 60 years. It's really approaching almost 70 plus years. And we're seeing more and more of these individuals coming in. They have teeth and they need these teeth maintained. One thing that was, referenced before and which really, really is true, the bacteria in the mouth, the dental conditions in the mouth do affect what's going on in our patients otherwise. And one of the very severe problems and very real problems that we see is that it affects our patients as far as their respiratory concerns. The leading cause of death, or one of the very close to top leading cause of death for this patient population, is the fact that they end up with respiratory concerns. And these respiratory concerns very often are linked to what's going on in the mouth. So we're dealing not just with the question of, well, it would be nice to get nice, bright, shiny teeth, but we're dealing with the question of how are our patients able to provide for their nutrition and how are they able to provide for their respiratory care. This becomes a question really of life and death. And so it's something really very, very important. One of the big problems that we see in New Jersey is that we have thousands and thousands of dentists in New Jersey. Certainly the number of dentists that we have in New Jersey isn't the problem, but certainly when we're dealing with who of those dentists and who among them are willing to see patients with disabilities, those numbers shrink dramatically. And there are really very few dentists that are out there that are willing to care for this population. I'll tell you as an educator, as somebody who's been providing education to our dental students in this state, the only dental school in the state for over about 25 years now. The problem is not necessarily education on the dental school level. Our dental school here in New Jersey, the other dental schools within the United States, they've gone ahead and they've been working to increase the amount of education for our dental students to get dentists prepared to care for this population of patients. The truth of the matter is very, very few dentists on the outside would need to care for the complexity of the patients that we're caring for. And, like I mentioned before, if we could have dentists who are on the outside in private practice caring for those patients who are less complex, that would free up the burden from us and allow us to care for the patients that need our care more so. And it would really, really expand overall access to care for this population and every other population that we have with a variety of disabilities. So what we really need First of all, as Senator Bucco had mentioned at the very, very beginning, we need to look at the finances. The reality is that dentistry, like many, many other businesses, works on, a margin that, can be kind of tight. And the reality is also, if the money isn't there, if it becomes so difficult financially to care for this population of patients, it's not going to happen in private practice. And so with most of our patients, I know 95 to 97% of our patient population here at the dental school within our program is covered by Medicaid. Those numbers need to be able to improve so that dentists will feel comfortable caring for this patient population. They're educated to do it, they're capable of doing it, but they have to be willing to do it. And part of that certainly is financial. The other part of it too really is also an educational issue. And one thing that we do have to look at from the educational issue is not really so much in the dental schools, but it's after dental education. If you're going into medicine, then there's a requirement to do a hospital-based residency, fellowships, and so on and so forth to become a physician. To become a dentist, once you graduate from dental school, you can go out into private practice. In some states, particularly in New York, for example, right next door, there's a requirement that dentists come out of dental school and do residency training prior to getting their licensure in the state. Personally, I think this is something very, very important. I think this will give our dentists even more of a background in caring for this population. It'll give them more of an impetus to care for this population as well, because they'll get more of the experiences in working with these patients. One thing that we really see, with our dentists starting off here in dental school, with the others who come in, there's a fear of working with the unknown. There's a fear of not being able to care for this population. And so exposing them to this population in a residency training program really, really is critical. And I'll tell you, that's really where I got my love of doing what I'm doing now. And I really believe this is something that would be very important for others as well. And then beyond that, there's the necessity to go ahead and work in education to create fellowship programs, like I went through. I went through a second year fellowship training after my residency. And this is something that we try to work with within the dental school as well, with our residency programs, and move people along. And these things are important. It's not necessarily just a question of education on the dental school level. It's a question really, really broadly going ahead and creating this educational platform. And then once we've got this in place, then going ahead and making sure that the dentists who are out in practice are constantly exposed and re-exposed to it. And so similar to all the continuing education that dentists and physicians and so on are really, really required to take in other areas, right? For example, opioid training and so on and so forth. If we go ahead and we can provide our dentists with the need to take training with working with patients with disabilities. Again, that's greater exposure. That really, really makes them realize, hey, there's a population out there that needs the care. The population is aging. Things are changing tremendously with this population. The population is growing, and that's creating, increased challenges. Those challenges aren't going away. And those are things that we really, really do need to, to think about in terms of how we're going to care for this population. There's a lot more I can say about this. It's an area that honestly, I'm very, very passionate about. I mean, like I said, this is what I've been doing for my entire career. This is something that I consider far more than a job. And I want to thank you all very, very much for your attention, first of all, and for inviting me to speak with you, because this really, really is something critical. When we're thinking about caring for the patient population with disabilities overall, it's very important that dentistry becomes part of this, because the mouth is the pathway to the rest of the body. And if we can care for the mouth really, really well, we're helping our patients really, really so far along. It's good for their quality of lives. It's good for the fact that they're alive as well. And it's important for keeping them that way. So again, what we do, it really is life and death. And so I want to thank you again very much. And certainly if there are any questions I can answer in those regards, I'd be more than happy to.
Thank you, Dr. Spivak. First, thank you for the dedication of your life work in this area. I've got to tell you that, it was alarming when you talked about 6 months for a general dental visit, but when you said the unimaginable 3 years for hospital room visits, I just hope that caught everyone's attention and underscores the importance of this conversation and the education and the training that you speak of in your remarks. I'm hoping that maybe we can move on, and I don't see any hands up. Dr. Spivak, I know you're going to stay here for the rest of the session, and we'll wrap up hopefully with any final questions. But right along your in your remarks, I was thinking about our third speaker. I'd like to introduce Hina Patel. Hina brings a unique perspective today because not only is she a 24-year dental hygienist, she has a son with autism, severe autism, and so delighted that she was able to join us, is able to join us today, talking about her son, her career, and advocacy in this policy space. So Hina, thank you for being here.
Thank you. Thank you for all being here. I'm delighted to hear both of these doctors about all the information we've collected and how we need to move forward. I have a New Jersey license in dental hygiene for the past 24 years, have worked primarily in South Jersey in private general practice, a little bit in Central Jersey as well. But I could talk about that forever. But more importantly, I'd like to talk about autism, being an autism mom, and how dentistry, my life in dentistry has changed with my son. So I'll just go ahead, keep it real brief because I could talk forever about this, and tell you a little bit about my son, Dante. He's 17. And he currently is residing in the Lindens program at Bancroft. He has been there about 5 months. Beforehand, he was in a group home, which he entered in 2022. And here's the story that I'd love for you all to listen to. So he went into this group home the end of August of 2022. The first week around Labor Day, he unfortunately went into crisis and was being combative with a staff member. Another resident came to help the staff member, and Dante hit the other resident's finger and broke his front tooth in half. So we got the call. Of course, me being who I am as a hygienist, was in a panic, wondering what the condition was. Does he need root canal? Is he in pain? Dante is nonverbal, so it is difficult at times to know what is going on with him and his mind and his body. He does have severe challenging behavior, so I knew that this was going to be quite the task to try to find a dentist who would be able to possibly treat him at like just lower levels of sedation and try to avoid the OR. However, that's not what happened. Even I, a person in dentistry, had a difficult time trying to find someone suitable that could offer him a high quality of care, because obviously that's important to all of us. And him being my son, it was of so much importance to me. It was his front tooth. You could definitely tell it was affecting him, that his tooth, he was kind of hiding his smile with his finger. This happened in September. We could not get him into the OR until April, which we use a dentist locally in South Jersey, a pediatric dentist that used CHOP. He didn't have a great experience post-operatively, unfortunately, had a lot of difficulty coming out of anesthesia, and then was sick a month afterwards due to the medication and everything that followed with that. So it's something that I would love to avoid in the future if, need be, but the tooth is fixed and everything is fine for now. So I do have the 2 points of view professionally. I think it's really difficult to be able to treat these patients. I am a hygienist. I am here purely for prevention. I'm literally trying to keep you out of the dentist chair and help you keep your mouth healthy and keep your body healthy. We do need to see these patients more than every 6 months. If they're in a group home setting or residential setting like my son, they're doing their best to try to manage behaviors, and some things just get tossed aside, like brushing your teeth 2 times a day. So with that being said, they're going to need more care. sure, I can see my son. It's no problem. He's great for me, but how about everyone else that's out there? I'm always like wondering what's going on with everyone. So from the professional side, I work for a dentist who just recently had to drop out of Medicaid because her reimbursements are too low. She just couldn't sustain it anymore. So that's an unfortunate thing that is happening. And from the mom side of it, it has to be easier than this. There's just way too many barriers. It's critical if he's walking around and he has a toothache and he's having behaviors and he can't communicate he has a toothache, then we are just going to spiral out of control. And so it's really important that we get these people, and he's 17 and he's going to be in the adult community soon too, so it is not just a pediatric level issue. This is a full life issue, that a population that they have enough barriers, and being able just to get them care that is required in life, I think it should just be so much easier than this. Like I said, I could talk on and on about this, but I would love to answer any questions that any of you would have for me. Thank you for allowing me to be in this space. It's an honor.
Thank you, Hina. Thank you for sharing the most personal information and for doing the work that you do, and bringing the sensitivity to your office. Hina and I had a chance to talk, and they're very lucky to have you in the current practice where you're working. Let's open it up. Before we do, I just want to also thank Assemblywoman Matsakos for joining us today. Matsakos, sorry. And I know that there are so many members of other legislators, staff who are here with us listening. We appreciate that. We know that this is such an important topic. And let's give a chance for members of the legislature to unmute and weigh in here. You've heard a lot, some very disturbing things. Can we have some conversation from our legislators?
Hi, Mercedes, Lou Greenwald.
Yes. Hi there. Go ahead.
So, I'm always touched by this conversation, and it's not new. I remember back in early 2002 when we were coming in facing a $9 billion deficit on a $27 billion budget at the time. And we were cutting programs for housing for the disabled and dental for the disabled. And, it was just very traumatic. And we found a way to put money in. And it's one of the early stages where before UMD&J had gone through its transition, we connected the Stratford campus with residents to go into the FQHCs. And we started with a pilot program at ChemEd in Lakewood. And it was a beautiful program. And I had taken a tour of the facility, and there was this open space. And I said, well, what's this for? And they said, well, we want to do dental and we don't have a program. And we had a population of disabled children, autism patients in that region. And we worked on a pilot program that became a model. But this is a constant fight. And I think it begins with, and that's why I'm so pleased to have people on from the School of Dentistry on this call. We need to figure out a way to make sure that this is a part of the routine training, and that this is offered not only in coursework, but also that the reimbursement rate from the payers makes this affordable and attractable for doctors to go into this, and so that the patients can be treated. So this, I think, needs a holistic approach to this, because we here we are 23 years later having the same conversation. And we have this conversation a lot around New Jersey's Medicaid rates that has, it has crossed over from Democrat to Republican administrations and back and forth. And it's an issue that really should just get resolved once and for all with a plan to approach it and to fund it and to increase it as we've done other things, whether it's school funding or pensions or surplus. This needs to be an attention of our focus, and it's good business. Not only is it the right thing to do morally, it's good business for New Jersey because it's one of our leading industries. So, and it will make us a destination point for doctors where we have a shortage. So I'd love to work with the group on this, and I thank everybody for being on the call.
Yeah, Mercedes, I agree 100% with the Assembly Majority Leader. You know, an hour just doesn't seem to be enough time to discuss all the issues and possible solutions for this topic. But one thing that I would like to stress is that on the individual basis where folks are running into problem with Medicaid or access issues, you know, they should, or they're having problems with bureaucracy, they should not be afraid to reach out to their legislators to let them know of the issues that they're having, because as we work through this problem on a legislative and regulatory basis, these problems are still going to exist, and these horror stories are still going to be out there. So it's incumbent on all of us that are on the call today, and our colleagues that are not on the call, to make sure that they're available to connect people with the resources that they need. So I can't stress that enough to those supporting agencies that are out there and the individuals that are on the call that are out there that could run into one of these problems. You know, I look forward to working with my colleagues on both sides of the aisle to start addressing these problems, reviewing the report, and moving this issue forward. But in the meantime, we can't just forget about the issue until we resolve the problem.
Well
Yeah,
said.
you know, Senator Bucco, you hit the nail on the head. I think it's really important for us to make sure that our constituents have the necessary tools and resources to meet those expectations. But so most importantly, making sure that we're making ourselves available. So thank you so much for Ms. Patel for your courage and making sure that we have an understanding of some of the things that you're going through and many of our other constituents, because dental coverage is critical for everyone. We have to make sure that we're providing those resources directly for overall health, and we can't neglect those that don't have the ability to be able to seek that type of coverage. So want to make sure that everyone knows that we are in full support. Anything that we can do is definitely going to be at the top of our agenda. So we encourage this partnership alongside of all of our colleagues. So thank you.
Thank you, Assemblywoman McCoy, and I see Assemblywoman Matsikosis' hand up. Matsikosis, sorry.
Yeah, that's okay. And thank you for this. I'm so sorry that I got on late. I have a sister-in-law who is severely disabled. She lives in a group home. She doesn't have any teeth because they had taken them out. She's almost 70 years old. So she really can't eat for herself. She's severely disabled. Anyway, and so when I hear that this is going on for 20 years, as the leader just brought out, that this is going on for over 20 years, it just sickens me, because I've watched what my sister-in-law has actually gone through over these many years. Because like I said, she unfortunately had to live outside of her home for a number of years. And then, you know, after a lot of fighting, we finally got her into a group home. And, you know, like I said, so this is personal to me. And the fact that people have to wait 3 years, it just, again, it just makes me very sad. This is really a bipartisan issue. I think it's incumbent on all of us. I will do whatever and however it takes. And I just want to thank all of the people that have been on the call and discussed this. And please, if there's anything that's going to move forward or anyone needs any help, I have made my residents very aware of that we're there to help them, because our disabled community is just the most fragile, and it's up to all of us to advocate for them. Anyway, I could just keep going on a soapbox about this. I will stop, but again, anything that I can do to help, I am all in. So thank you so much.
You could keep talking, Assemblywoman, because that's what we need. We need that energy. We need that commitment. The struggle is real. And unfortunately, while this blueprint and this report exists, the work now needs to be done to bring about change. So we appreciate our speakers today shedding their expertise and the light on this issue so that we can continue that conversation. I'm going to ask our speakers, and we have a few minutes left, if there's, based on the rest of what you heard during this conversation, if there's anything you'd like to share or add. I'll start with Dr. Fossey.
Thank you so much. Just a couple items, some food for thought. There's been some more activity, again, at the federal level with the National Council on Disability, authorized by Congress. They've looked at Medicaid dental plans and have some recommendations for states on what to do to improve care, improve access for people with IDD. I'll make sure to send those to the council staff. They might be helpful in next steps as well. You'll see some of the folks from that project were part of this one, but then some others who work in this space did other aspects of that. And then another area that I didn't have much time to talk about is on the operating room access and scheduling. There have been federal developments there as well, where CMS, the Centers for Medicare and Medicaid Services, has now instituted a facility fee. And that was the problem. That was one of the many problems that exist, because dental cases still aren't adequately reimbursed in the operating room. But this is a big improvement where finally hospitals are getting some payments. Before, they would have to schedule the more lucrative cases. We have a lot of room to go, but CMS has created the infrastructure for this. New Jersey has actually instituted bits and pieces of it, but it's been more so in ambulatory surgical centers, also very important, but more needs to be done on the hospital front. And my understanding is in the state of New Jersey. I could be a few months out of date on that. But there's a lot of activity there so that hopefully we don't have those 3-year waits that Dr. Spivak was mentioning. And so I'll share some information on both of these things with the council staff.
I appreciate that, Dr. Fossey. Dr. Spivak, a minute. You got?
Yeah. One thing that's been, that really has been said over and over again that really is important is that this is a multifactorial problem, and it comes from a lot of different sources. One of the things I think that really can be extraordinarily helpful is to have a step put forward where we really are requiring that dental students who graduate as dentists are required to get residency training. That's something that really is going to really dramatically improve the access to care for our patient populations. It has to be along those lines. So when we're talking about education really is critical. And I think if we're approaching it in that direction from the right way, we're going to help, honestly, not just the IDD population, but truly it's going to be something that's going to help every resident of the state of New Jersey. I mean, there's just no question about it. So, as a take home, as a key point for me, I think that really is right up there. Again, thank you all very much. I really do appreciate what I'm hearing. I appreciate your motivation and your passion.
Thank you, Dr. Spivak. So we do have a commitment here. We have good energy here. I'm Dr. Spivak, Dr. Fossey, Hina Patel. You will probably get a call, so don't change your number. Look out for that commitment. Assemblywoman Matsikotis and McCoy, we've got your number. And I do think that, one of the recommendations of the report was to bring together a task force. And this is not a group of people who will just sit and sit and sit, but really hone in, focus. We've got your attention at the legislative level, and our community deserves better. And I think we have a job to do now to make it better. So I'm going to go back to Senator Bucco to close us out, but our next session October 22nd. Tune in to that hour to kind of graze another issue. Senator Bucco?
Thank you to everyone, all the professionals that were on the call, to the presenters today. As I said earlier, this is a critical topic, and I look forward to moving the ball forward with my colleagues on both sides of the aisle. So thank you, everybody. Enjoy the rest of the summer.
Thank you.
Thank you all.